Okay, it's going.
Okay, I'm Natasha.
I'm Haley.
I'm Laurie.
I'm Allie.
I'm Brenna.
Okay, so we can do a practice one.
Run through it really fast.
Okay, so
Go through it like we normally would, like as if it was real, but then at the end, if anybody has any extra criticism or feedback, go through that.
Yeah, sounds good.
So our presentation is over medication errors. The purpose of our presentation is ensuring the drug is given to the right patient. Oh, sorry, no. Is reducing medication errors. We're going to do this by explaining the dangers of medication errors and informing on how to help prevent them.
Our key question for our presentation is how can one avoid medication errors, specifically medicines? A few things you can go into are documenting everything, double checking and even triple checking things when you can. You want to take your time, go through all the step-by-step procedures of checking identification, following the 6 rights, and a few questions that pop up with this key question, how or why these things happen. And the work environment in healthcare can become really stressful and hectic at times. And so under certain circumstances, things can get skipped over or wrongly placed, which can cause these errors. Safeties on medication errors. Medications are supposed to be safe for those who need them with the correct dosage, type, brand, etc. And when the medicine is administered to the wrong patient, this arises many complications, and specifically, it can cause death. So from Centers for Disease Control and Prevention, I found a statistic that each year in the United States, harm resulting in medication use causes more than 1 million visits to hospital emergency departments. So learning about medication safety can reduce these and even prevent the risk of harm for you and me. Some things that hospitals include in their processes to make sure safety precautions are being taken include scanning the patient's ID bracelet and the medication barcode to make sure they match, knowing what type of errors can occur at most, and knowing background on what the medication is supposed to be treating, and knowing that the patient is online for that particular treatment. Lastly, keeping updates lists of all medications that stay with each patient. And when in doubt, the best thing to do is ask.
Okay, so next we're going to talk about the 6 rights, and this is just when you're giving a medication. Every single time a nurse gives or anyone gives a medication, you have to go through these 6 rights, and it's really essential to use this because obviously it can decrease medication errors and decrease the risk of harm to the patient. And so we just make sure that the patient is getting the best care possible, and we're limiting any mistakes that we might make. And so the 6 rights are the right person, the right medication, the right route, the right time, the right dose, and then finally the right documentation.
So the first one of the 6 rights is the right person, and this is just ensuring that the drug is given to the right patient. They do this by using 2 identifiers before giving the drug to the patient. They can do that by asking the patient for their name and making sure that name matches the one that's on the medication package and the patient's wristband. They also do that by scanning the wristband and the medication. And if a patient is unconscious, they do this just by matching the patient's wristband to the name on the package of the medication.
Okay, so next, the right medication. That's the next right out of the 6. So that's just making sure that you're administering the correct drug to your patient. So in order to do that, you have to go through 3 different checks. So the first check should be done before removing the container or the drug from the drawer or the shelf. The second check would be like when you're pulling up the medication and removing it from the container. And then the third check should be done at the patient's bedside. And then, so those are your three checks. And then they also have a do not use list of medical abbreviations because some abbreviations can be interpreted in different ways. Also, if your patient questions a medication, you want to make sure to recheck the medication because they usually know like what color their pills are, how many pills they get. And then some medications look and sound alike, so that's why you want to recheck if your patient is questioning it or also not using those medical abbreviations. And then other things such as AMDSs or BCMAs. So those are just computerized systems that reduce the risk of medication error. And it shouldn't be used as a workaround, but as a tool to utilize to prevent medication errors.
Okay, then we have the right route of medication. There's different types of routes that you can give the medication through. First, we have the non-parental routes of administration, and that's basically anything that is not through an IV or a needle, rather. So it could be through your skin, it could be through your mucous membranes, oral medication, anything like that. It's important to know which medications work in which ways, because some medications might not work in the same way that another medication will. So for instance, like something might not work if you give it, orally versus if you have to give a medication rectally. They just work in different ways. And then there's also the parental routes, which is anything given through an IV, or a needle rather, subcutaneous injections, anything given in the skin. You have intradermal, intramuscular, anything that is put into your muscle. And then there's different ways of doing that as well. And then you also have intravenous injection or infusion, which is through the IVs.
So the next right is the right time. And this is basically just making sure you check the order and make sure you give the medication at the time that needs to be given. So I just have a few examples of different times that might be written on the order. Some like PRN, which is as needed, and just as an example, like pain medication, the physician can write an order as needed, and so if the patient says they're not feeling well or if they're in a lot of pain, then you can go ahead and give the medication when they request it. And then there's stat, which has to be given right away, so you can't like dilly-dally about it. You have to like get it to the patient. And then AC is before meals, PC is after meals, and Q2H or Q4H, whatever number you happen to have in there, means every 2 hours, every 4 hours, however much the physician says that needs to be given. And then HS is at bedtime. So those are just a few different things to kind of be aware of when you're looking at orders and trying to figure out what time the patient needs the medication.
And then we have the right dose, and giving a patient the right dosage of their medication can be crucial as well as all the others. You can do an undercount or an overcount, and this can cause delay in treatment or worse. The correct dosage is given to you by your doctor, and so it's based on your own personal profile, which includes your age, weight, your organ functions, and other conditions that you may personally have or not have.
And the final right is right documentation. And so on the record, whether it be on the computer or written down, you have to write the name of the medication, the dose you gave, the time and date that you gave the medication, and then the route of administration, so wherever or however you gave the drug. And then you can also write there if the patient were to have some sort of reaction to the medication, or even if the patient has the reaction that you want them to have, just pretty much anything that happens to the patient, you should record down. And lastly, you need to have your signature or initials afterwards so they can tell who gave the medication. And this is something that you do after each medication is given. So even if you have to give 6 medications to a certain patient, you give 1 dose and then you document it, give the next one, document it, just to make sure you get everything down at the right time. And then, so by doing this, it really just helps, like, you know exactly what you gave, the physician knows, and then also following nurses on other shifts, they can look back and see what time that the patient got the medication, and then go from there. If like the patient needed it every 4 hours, they can look at that and see exactly when the medication was given. So it really helps everybody in the situation.
Okay, so there are assumptions made, and that is part of what can cause medication errors. Like, patients often believe that nurses know what they're doing, so they don't think to question them about, like how we mentioned before, that they know what color pills and how many pills they take. And so if a nurse gives them that, sometimes they won't question them, even if they think it's wrong, just because they think the nurse knows what's going on. And the nurses also, like if they've had a patient for a couple of days, they'll just think that they know what the patient's orders are, but it could have changed, and so they just assume they know what they're doing, and they can give them the wrong medications. When they make these assumptions, it just helps influence medication errors, and patients need to make sure that if they have questions, that they are questioning the nurse. They shouldn't be afraid to question them, and nurses should make sure that they are double checking everything and rechecking orders, even if they think that they know the patients.
And then we have inferences and conclusions. The major concept of avoiding medication errors, which is our topic that we talk about, are the 6 rights. We incorporate that as, the big, I don't know what word I'm looking for. We just incorporate those as like the most important guidelines to follow when giving medication. So following along with these is good nursing practice, as well as medications given with their side effects are going to be what is most important in avoiding errors. The concept ties everything together that has to do with medication errors. And by following these guidelines and making people more aware, hopefully we can decrease the percentage of the medication errors that are happening now with upcoming generations of future nurses.
Okay, so positive implications of avoiding med errors, obviously. If the correct patient receives the correct medication, the correct dose, everything through the right route, those will have a therapeutic effect on the patient, and that's the priority. It'll lead to patient satisfaction, less pain for the patient, treatment of chronic pain and illnesses, and other diseases that medications help, like with side effects and stuff, like, not side effects, symptoms. And then another positive implication would be avoiding, it decreases adverse effects, toxic effects, allergic reactions, because the patient will be receiving the correct medication. And if you go to the next slide, negative implications, nurses and hospitals can actually be sued for malpractice. So that is why it is so important to follow all of these rights. Make sure that you're checking your medication 3 times and really trying to prevent medication errors. And then another negative implication, more time is spent preparing the medication than spending time with your patient, but essentially preparing the medication is the most important thing. because if you don't prepare your medications correctly, this could cause severe harm or even death to your patient. And then, like I said, hospitals and healthcare professionals can be sued as a result of medication errors. And then point of view, 4 out of 5 of us in this group are going to be nurses. So we're obviously looking at this from a nurse's point of view, what nurses can do to help prevent medication errors, and what we can do to prevent medication errors when we are nurses in just a few short years. And then we're looking at it from a point where medication errors are serious, but we are the ones that are able to prevent them from happening. So that's why we've been listing multiple ways of reducing those medication errors and making sure that we take extra precaution when we're dealing with patients and administering medications to them. And then in conclusion, like I said, medication errors have been a huge issue in the past, but they can be prevented, and nurses need to take the extra time and effort to ensure that they are administering medications in the correct way. Doing those 6 checks all 3 times, and ultimately getting therapeutic effects of the medication and making sure that those patients are safe and satisfied with their care.
Is anyone paying attention to the time? Because I forgot to.
Oh, no.
Yeah, I got it. I started like maybe 2 minutes late, but right now it's at 15 minutes.
Oh, good.
Perfect.
Okay.
So I did notice, like, none of us looked into the camera.
Okay, yeah. So that's what I was gonna say. We're all looking down, like everybody is at, but we should be like looking like at ourselves.
Okay.
Okay.
Instead of
I was looking at you guys.
Yeah.
Yeah, I always look at you guys too.
Yeah.
So it's like I noticed Natasha when you were talking, you're like looking back.
Sorry. I'll try to look up. I just like, okay, I like look at my notes, but I'll make sure like make eye contact with the camera more often.
One more thing I thought about. So Natasha, you have quite a few slides in a row. So it sounds like you're talking a lot. Does somebody else want to pick up the conclusion at the end and it off?
That's fine with me. I don't care.
What do you? I mean, what does everybody else pick up on that?
I don't care.
Do you think I'm talking too much?
I mean, I don't.
Just at the end.
Too much. Just. I don't know, because
Anyone else hearing that echo?
Yeah.
Okay.
Can you still hear like somewhat decently?
Yeah.
Okay.
Mhm.
Yeah, it just said that each team participates in equitable.
I think I think that we each like talk for a good amount of time. So if someone wants to pick it up, they totally can. Otherwise, I'm fine with.
I'm the only one.
Well, we could even just like move
That
would help.
Okay, we could see if we could rearrange them somehow.
Maybe it was just.
So maybe I could do. We could do maybe like, could we move inferences and conclusions like behind my point of view?
Yeah.
And then Lori could.
Yeah.
Is that you, Laurie? Okay, you could do that at the end, and then I could say the conclusion. Would that split it up enough, or would someone maybe want to take the conclusion as well?
I think that's fine.
That's okay.
Yeah.
So I already turned it in.
Oh, it's still fine because we're
You
talking
think it's
about
okay?
how we're changing it right now.
Okay, so this will go. Oh, did someone do it?
Yeah, sorry. I did
Okay,
it.
sweet. No, good. Awesome. I was like, wait, what? Okay. Other than that, did anyone notice anything else?
I think just like making sure we're not like, I always feel like I say this and then I end up rushing anyway, but just making sure we're not like talking too fast while we go through our slides, I guess. But I mean, we were at probably like 15 minutes, so.
Okay, so that's good time, right? What was it, 15?
Yeah.
15 or something?
Yeah.
It's like 15
So,
to 18, right?
So just making sure that we like keep it the way we kind of did.
Okay, perfect.
Sounds good.
Are we ready to do it for real?
I know, I feel like I should like look more presentable than this. Sorry. Okay. Also, I kind of like was freaking out about my first slide because I was like, oh my God, what do I say? So I feel like maybe I should.
Oh, when you turned in the paper, did you put our group name and all that stuff? We're supposed to.
I think that's for our like paper that we write ourselves.
We're supposed to put it on everything.
Okay, so for like the rough drafts and stuff, I wrote like our team name.
Mm-hmm.
And is that what you're? Oh my God, you guys.
What?
Even if you put it on like like you know how you can write in when you upload it, and then there's a section you can write in.
Yeah, I already turned it in, and I don't think you can turn it in twice. But is there a way we can pause this video?
Wait, okay. So I think if somebody else in our group turned one in and says like, this is the final one.
Well, I have like it just says
Our names.
final. It says final presentation paper and final presentation PowerPoint. And if he clicks on it, he can see our names.
Okay.
It should have our team name.
I'm sorry, I should have said it before.
That's okay. I can try to go back and change it. Should I go in?
I think it'll be okay. It's not that big of a deal.
No, because when he clicks on it, he can see our names.
Yeah.
It's okay. Is there a way that we can pause this though?
No, I have to like stop the broadcast and restart it.
Okay.
I think it'll be fine.
Okay. All right. Sounds good.
All right. So starting the team oral project presentation. Yes.
Okay. So we did our presentation over medication errors, and the purpose of our presentation is to reduce medication errors. And we'll do this by explaining how dangerous it can be when there are medication errors and informing people on how to help prevent medication errors from happening.
So our main key question is how can we avoid medication errors? And by doing this, we can make sure we document everything, write everything down that needs to be written down and noted. We can double check or even triple check sometimes, make sure that things are right. And also we want to make sure that we take our time to follow through each step-by-step procedure of checking people's identifications and the medication identification. By doing this, we can follow the 6 rights. And some other questions that arise from this is how or why did these things happen? And in the work environment of the healthcare field, it can become very stressful and hectic. And at times and under the circumstances, things tend to get skipped over or assumed or wrongly placed. So we want to make sure that we're following all of those. Some safeties that we can go into about our medications need to be in the correct dosage, type, brand, etc. When the medicine is administered to the wrong patient, many complications can come above that, like death. So a statistic that I found from the Centers for Disease Control and Prevention website, they stated that each year in the United States, adverse drug events can cause more than 1 million visits to the hospital emergency departments. So learning about your medication safety can definitely reduce and prevent the risk of harm for everyone, you and your loved ones. Some things that the hospitals include in their process to make sure safety precautions are followed are like scanning the ID bracelet for the patient and the medication barcode to make sure that they match, knowing what type of errors can occur and occur the most, knowing a background on what type the medication is supposed to be treating, and making sure that the patient is online for that particular treatment of the medication. Lastly, the best thing to do is keep updated lists of all medications that stay with that patient. And if you're unsure, just make sure you always ask.
Okay, so next we'll talk about the 6 rights. And so these are just something that you have to go through every time someone's giving a medication, just to make sure that you are decreasing the amount of mistakes that are being made and making sure that patients are getting the best care possible. So there are 6 rights, and it is the right person, the right medication, the right route, the right time, the right dose, and the last one is the right documentation.
So the first part of the 6 rights is the right person. This is ensuring that the medication is being given to the right patient. They do this by using 2 patient identifiers, such as asking the patient their name and making sure that matches the name that's on their wristband and the name that's on the medication. They can also do this by, when patients are unconscious, they do this just by making sure that the name on the wristband is the same as the name on the packaging for the medication.
Okay, the second right out of the 6 rights is right medication. So that's ensuring that you have the right medication that you're administering to the right patient. You can ensure that you're giving the right medication by comparing everything, your 6 rights with the MAR, and make sure that you're doing this 3 times. So the first check should be done when you're removing the medication from a drawer or a shelf. The second check should be when you're comparing that medication with the medication administration record, which is the MAR. And then the third check should be done at the patient's bedside before right before you administer the medication to the patient, ensuring that you have the right patient in the first place. There's a do not use list of medication abbreviations because some drugs can sound alike, other abbreviations can, they can just get confused with abbreviations. Another thing you can do is if your patient questions the medication that you're using, you want to make sure that you recheck that medication again, because usually patients know what color their medication is, how much medication they usually receive, stuff like that. So just recheck that before you administer it. And then some medication, other things that can prevent medication errors are computerized systems. So automated medical dispensing systems is a computerized mechanism that can control the dispensing of medications. And then another one is using the barcode medication, just scanning their barcode, like Haley said earlier. And this can ensure that you're giving your patient the right medication, and scanning that barcode ensures the right patient. So in general, these computerized systems help reduce the instances of medication errors. And you don't want to use this as a workaround. You want to also ensure that you're still checking those 6 rights all 3 times, and then using this as a tool in addition to checking those 6 rights and so on.
Okay, then we have the next right is right route. There are several different routes that the medication can be given. First, there's the category of non-parenteral. Basically, that is anything that is not given through a needle. So medications, like you can do inhalation, oral mucosa, or oral and then mucous membrane route. Anything on your skin is topical route. There can be advantages and disadvantages of those in relation to the patient as well. For instance, like inhalation, it goes directly into the lung tissue, so that is a good advantage for using it, but a disadvantage for the patient could be that it doesn't make them feel very well, or to make them very jittery because of the medication. So always wanting to check with the patient as well and their reaction to giving it. Then there's also parenteral routes, which include anything that is given through a needle. So subcutaneously, anything through your skin or underneath the layer of your skin, the top layer of your skin, intradermal. You also have intramuscular route, which anything into any of your muscles. And then you have your intravenous injection or infusion, which you can put anything into an IV or an infusion that is already running, and go ahead and mix that together. So, like I said, just make sure that you're always checking the patient reactions for these as well. IV is one of the quickest ways that it does react in your system. So you want to make sure that you're definitely keeping an eye out.
So the next right is right time, and this is basically just looking at the order and making sure that you're giving the medication at the specific time that the order was given. And so a few examples of what might be on the order are PRN, which means as needed. And just an example of this is pain medication. So the physician could order a certain type of pain medication and to be given as needed. And so when the patient happens to be in a lot of pain or needs another dose, then they can specifically ask for the pain medication and then give it, as long as it's within the right parameters of the medication. So another one is STAT, and this is to be given immediately. So if you ever get an order like this and it says STAT, it needs to be given right when you get that order. AC is before meals, and PC is after meals. And then Q2H is every 2 hours, and then you can switch out the number for however many hours in between the medication that you want to give it. So it could be every 2 hours, every 4 hours, whatever it is that the patient needs it. And then the last one that I have on here is HS, which is given before bedtime.
So then we move on to the right dose, and giving a patient the right dosage of their medication can be very crucial. There can be an undercount or overcount, in which can delay treatment or worse. The correct dosage is given to you by your own doctor, which varies all on your own personal profile. So the things that factor into this include your age, your weight, your organ function, like your kidney and liver to process those medications, and your other health conditions that you may or may not have compared to somebody else who's taking the same medication.
Okay, and then the last right is right documentation. And so after you give a medication, you will write down either on the computer or in written form. You have to state the name of the medication that was given, the dose, so the amount of medication that you gave, and then you need the time and the date that you gave it. You need the route of administration, so whether you gave it IM or through the IV, whatever that may be. And then you can also write in there different reactions that the patient might have. So if, say, the patient had an allergic reaction, you want to write that down right away to make sure that future people, don't give that again. And then and also you can write down if they had the response that you wanted them to have. And then lastly, you need to either put your signature or your initials afterwards, so someone knows, so other people know who it was that gave the medication. And another thing why documentation is so important is because future nurses, like in the next shifts, or the physician, or if something legal were to happen, can go back and look at what was written and know exactly when the medication was given, what was given, why it was given, so people can know, when to give their next dose, or if they did have a reaction or anything like that. So it's really important to make sure you get it all down correctly too.
Assumptions are oftentimes what cause medication errors because the patients think that the nurses know what they're doing, so they don't question them. Like you mentioned before, the patients know themselves best and they know what pills they take and how much they take. And so if something is given to them and they don't think it's right, oftentimes they won't question it because they think the nurse knows what she's doing. The nurses also oftentimes assume that they know what they're doing. If they've had a patient for multiple days, they may just think that they know the patient's orders and know what meds need to be given when, but that doctors could have changed the orders and things can change easily. So they just need to make sure that they're going back and checking the orders instead of just assuming that they know what was going on. When nurses and patients assume is when medication errors occur because they aren't double checking and they aren't being safe, and they just need to make sure that they double check everything and that patients aren't afraid to ask if they feel like something's wrong.
Okay, so some positive implications of avoiding medication errors. So obviously when the right medication is given using all of the 6 rights, this leads to patient satisfaction. It'll lead to the therapeutic effects, so like less pain for patients that are in pain, treatment of chronic diseases, which can also be painful, and just other diseases that need medication. And then avoiding med errors, so using those 6 rights, like I said, decreases adverse effects, toxic effects, allergic reactions, because the patient will be receiving the right medication due to those 6 rights. Like we said, patient safety is a nursing priority, and medication errors are completely preventable. So we are obligated as nurses to use those 6 rights to ensure patient safety. Negative implications of avoiding med errors. This could mean that more time is spent preparing the medications than patient interactions, but essentially preparing the medication, taking the time that is needed to prepare those medications is a nursing priority. You have to make sure that you're doing those 6 rights and ensuring your patient's safety, even if it does mean spending a little bit less time with your patient. And then other negative implications of medication errors. Severe harm can be done to the patient if they're given a wrong medication, if it was done through a right route or an incorrect route, if they were given the wrong dose. Patients can even die from medication errors. And also, after an error happens, hospitals and medical professionals can be sued for malpractice if they're not ensuring the safety of their patients. Points of view. We kind of just decided that since 4 out of 5 of us are in the nursing program, and that will be nurses in a few years, we wanted to look at this from the nurse's point of view, from the nurse's perspective. So it kind of just gives us reasons to, and it helps us prevent medication errors, because we realize that medication errors are a serious problem in the medical field, and that they're completely preventable. So because we've listed these ways of preventing medical or medication errors, this will hopefully help us to ensure that we're being extra cautious when we're dealing with our patients, when we're preparing and administering medications to them.
Okay, and then we had inferences and conclusions. Basically, the major concept of avoiding medication errors. We tied in the 6 rights to this because that's kind of the concept that you want to follow in avoiding all of these. So good nursing practices, as well as knowing the medication given with their intended side effects, because you want to be able to, know if a patient is having a side effect that they shouldn't be having. The concept ties everything together that has to do with medication errors. And by following these guidelines and making people more aware, we hope to have the percentage of medication errors drop with basically upcoming nurses and future generation of nursing.
Okay, so in conclusion, like I said, patient safety is a nursing priority. So medication errors should be prevented at all costs. So nurses need to be taking the extra time and the extra precautions to ensure that they're administering the correct medication in terms of doing all 6 checks 3 different times. And then essentially what we want is for our patients to be safe and satisfied.
So now it says, as a team, we are to spend a few minutes discussing our individual reactions and experience about this, thoughts, feelings. What did you think was positive in this? What do you think was negative? How were everybody's confidence, skills, and everything like that?
Okay, so I'll start off by saying that I'm really glad that we didn't have to give a presentation over something that doesn't relate to our profession. Picking something like medication errors is something that we will be preventing as nurses every single day, because our patients, obviously, many patients require medication. So we will be doing this literally every single day of our lives as nurses. So I'm happy that it was like a relevant topic. Because even though we learn about it in class, doing more research on it and like making a presentation and a paper about it, I think has helped me understand the importance of how like cautious I have to be and how much time I have to spend preparing medications for my patients. So I'm just glad that it was like a relevant topic to my profession.
And I know in my point of nursing, we actually haven't gone over medication errors yet. So it kind of helps me as well, kind of know what I'm coming up to. Kind of gives me that guideline or the start of it, so I can know kind of what to look forward to.
I also feel like it's something that's like obviously just like really important when it comes to like the medical field in general. It's just like, I mean, I'm sure all of us have taken medication at some point, so it's just like relatable to everybody too. So it's just like super important to know, especially if you're giving medication to somebody, like as a nurse, but even as, you know, like a parent or, you know, a sibling or just like a friend giving someone, you know, Tylenol at some point. Like it's important to know like different things about the medication and like what you're actually giving somebody, because it can cause a lot of harm if you don't know what you're doing. So
absolutely. Also, I noticed that our eye contact was better. I don't know about mine, but
yeah, I noticed that too.
What else did we have to say?
How are your team's confidence and presentation skills developed in and throughout this experience? I think we all, like, even from the beginning to now, we're all more comfortable talking. And I think with this, even running through it the first time and then like finally presenting it, we just improve each time. So
yeah.
And I feel like this way of doing it is a lot easier to be confident than if we were to be like standing up in front of a class and like giving this presentation. Like this just makes it a lot easier for me, at least.
Absolutely. Me too, because I personally hate public speaking.
Yeah, I do too.
Yeah, so from like the things that we've talked about like our values as a team, like not judging each other and actually making sure that we're listening to each other. Like I know that you guys are a good team, and I know that you're not going to judge me. You're not going to, I mean, you may laugh at me if I mess up, but I'll laugh at myself, you know, like, so I was more confident just kind of doing it in front of you guys than just in front of a whole class.
Yeah.
And that's somewhat why I took this class online, hoping to get a good team, you know. So
yeah.
I think we got lucky. I think our values were good. because we had to state our team values, because we had to do that, I think we were a better group overall. Less judgmental, no judgment. Stuff like that. So I think we did a good job.
So another one he asks on there too is like what this course can help you professionally with and in your career. And again, like kind of like what Natasha said, like just being able to like talk about stuff that like actually is relevant to like what we're learning at Mercy. And I know we're not all going into nursing, but even then, like it's just like important stuff to know. And like even throughout the whole course, like we were somewhat like able to like learn about stuff that we wanted to learn about. So that was really nice.
Yeah, absolutely.
And I think it gave us insight too, and like small talking with small groups versus, I think it gave us better insight with small groups versus like a large group. And I know that we're going to have to come across that in nursing. So I think that helps too.
Yep. I feel like most of nursing, I feel like most of nursing will be working in small groups, not like huge groups, like if we were in a classroom with like a whole class of people, you know, like there are what, 1, 2, 3, 4, 5 of us, 5, 6, 1, 2, 3, 4,
5
of us. There are 5 of us, and you know, sometimes you're only working with one other nurse, like when you're preparing medications, like with insulin, you have to like do it with one other nurse, you know, so we'll be working in small groups every single day. So this has helped me with smaller groups rather than a larger like classroom setting. And then also Haley, since you're not going into nursing, but if you see something, at least you have knowledge about it now, and then you can be like, oh, you know, like maybe you want to check that 3 times or.
Medication errors happen everywhere, even if you're giving Tylenol to your friend. But hoping to go into OB sonography, like my patient needs to be making sure that she's taking the right medications, because it's not only about her. I'm worried about 2 bodies now, so
Right. Absolutely,
it's just very risky for everyone. So I mean,
yeah, and also on top of that, sorry, go ahead.
You're probably going to be observing the side effects sometimes too.
That's what I was saying. You want to know how it affects their body.
Yeah, following up with everything after, if something does happen wrong, I'll be going through with dealing with that stuff.
Absolutely.
Hopefully that stuff doesn't happen. We want to
yeah. But who knows, maybe it will, so you'll be better prepared because of this, for sure.
Definitely. I will take it with me.
Definitely. What's next?
I think that was it, wasn't it?
Oh.
Finally, share your thoughts about any other reflections or you may have as individuals concerning your project experience.
Okay.
I had a good experience. I was in a group last semester that we had to like do online stuff like this, and it was like really, really difficult because like I think it really just depends on the people that you end up being with, because I mean I felt like I was having to do all the work and no one was really helping at all. So it was like just like a huge change from like that group to this group. So I think it's just really nice to be like working with people that like also want to do well and like are trying and stuff. So
yeah, I feel like each one of us contributed 100%. Like we did everything that we were supposed to do. We split it up. There were no missing parts. So yeah, like you said, everyone like really wants a good grade, so everyone is contributing the correct amount. So yeah, I agree with you.
Yeah.
And I've never had an experience like this before, so I feel like having a group like you guys, like I might not dread it if I have to do it again.
Yeah.
You know, it kind of gives me like what it could be like. So hopefully that is the case in the future if I do have to do it again.
Yeah, just hope you'll have a group as good as us. Just kidding. You guys are great, and I really enjoyed working with you.
Yeah.
Just like you said, sometimes you just get stuck with a really crappy group.
It happens.
Yeah. So it was a nice change from the Yes, for sure. So basically, I think Brenna, do you want to turn in this video.
Yeah.
Okay, and then I turn in the PowerPoint and the paper. So I think all we have left to do is the reflection. I do have a question. Does anyone know, like, if there is like a guideline for that? Like, is there a paper that we have to go and like answer questions from, or is it just like a 1 to 2 page?
So I have this, and this is the guideline and processes sheet, and on the back, like all the way at the bottom page, it gives like a project follow-up, and it says team member peer evaluation reflection paper, and it just gives a little paragraph on like, it just says 1 to 2 pages, personal reflection indicating your peer evaluation score out of, so you have to go through each person and say 0 to 100 what their score was.
Oh, okay.
Individually team members' work and contribution throughout the whole project presentation. And then it also says that
Oh, I see it now.
this will account for 25% of each student's total grade. So,
And I said it before we started recording, but I already wrote mine.
Oh, did you?
I did, because I didn't think it was going to change after we did this one more, Google Hangout thing or whatever. So I already wrote mine, but I didn't write each person and individualize anything out. I kind of did I summarized it and just basically talked about us as a group together.
That should be
so I didn't say each person and then put a score. And then when I did it, I felt like we all deserved basically all the points because we all participated. We all showed up. We all did our best to, get together and do our part.
Okay.
So
I honestly think that you should be fine. It does say articulating score rationale for each of your individual team members. So if you just gave us all the same evaluation, then that should just, I think.
Also, in bold, it says at the bottom, so when you turn in your reflection paper, make sure your name along with your team name and your project tile is on there.
Okay.
Which I forgot to do.
Okay.
What is our team name? I forgot.
That's why I pointed it out for that one.
It's 4 nurses and a sonographer, I think.
Okay.
Yeah.
But, okay, I will say this. I'm not sure if he's, as strict, because I know that, Dr. Joe Moravec, he made this class. Yeah. What'd you say?
I saw his name on that paper, too, so.
Yeah. So he was always a stickler about, put your name on this, put your name on this. So, maybe he'll be a little bit more lenient. I don't know. But, do you guys want me to try to go back and, fix the...
No, I think we could, if we're really that worried about it, we can email him and be like, hey, we didn't put our team name, but we have all of our names on it. Is that okay?
I'll just make sure we put the team name on your individual reflection paper.
Because I think all of our first and last names are on there. It should be fine.
Yes.
Yeah, I think so too.
Yes.
Okay. All right.
Did we end?
Hopefully we just don't get dark points for that. So. Okay, cool. Is that it?
I think so.
I think
Thanks
so.
for being a good group, guys.
Thank you. Good luck with everything.
Thanks. Yeah, you too. If any of you guys